Well, as you can tell, we're in the veterinary medical portion of our program, and our next speaker, who's going to tell us more about zoonotic diseases, comes to us from education at Cornell University, and right after leaving there, established the Summer Street Cat Clinic here in Buffalo. If you're not familiar with it, it's a facility in the center of Buffalo. And she's, in addition, a participant in Western New York Veterinary Organizations and the founder of the Pet Emergency Fund, and also serves on the New York State Board of Veterinary Medicine. Dr. Levine.
I want to thank you for including me in this symposium. It's been very enlightening and interesting and thought-provoking, and I'm very grateful to be here. So today I want to talk a little bit about cats and zoonotic diseases. Zoonotic diseases are diseases that are spread from animals to people. And here are a long list of diseases that we're familiar with. There are many, many more diseases. It started really, well, it didn't start with, but plague back in the Middle Ages was one of the more common zoonotic diseases. Rabies, ringworm, toxoplasmosis, and the list really goes on and on. Today I'm going to focus on two of them in particular. I want to talk about toxoplasmosis, which I think is one of the more misunderstood zoonotic diseases, and I'll explain shortly why that is. And I also want to talk about rabies, which is one of the most deadly zoonotic diseases, and give a few pointers and that sort of thing. I'm also going to briefly touch on immunodeficient people. Years ago, the category included very few people, and in recent years it has just expanded exponentially to include many, many different categories of people. With an impaired immune system, you're particularly susceptible to zoonotic diseases, and taking precautions is all the more important. So toxoplasmosis, I am still hearing after decades that pregnant women are being counseled to get rid of their cats. This is also known as the Ladies' Home Journal disease because back in the early 70s, when they made the connection between toxoplasmosis in cats, everybody was cautioned to get rid of their cats, whether they were pregnant or not, that this was a great danger to people. As we know more about it, we know that this is really not the case at all, but unfortunately I'm still hearing young women coming into my practice who are being given this advice. So yes, are cats to blame? In a way, yes, because cats are the definitive host, so they're the only species in which the parasite can complete its life cycle. If we got rid of all the cats on Earth, we would eliminate toxoplasmosis. That is not going to happen, thankfully, so we have to understand the disease a little bit better, and we'll find out that it really is not a great risk to us. So avoiding cats will not protect you from toxoplasmosis. We have found through many studies over the years that the incidence of toxoplasmosis is not related to cat exposure. Households with cats, households without cats, we have the same incidence of toxoplasmosis, so we are not getting this disease from our cats. And if we look at the life cycle, we'll figure out why. So your cat is exposed to Toxoplasma gondii, probably from eating a mouse or some other, or from eating undercooked meat, and we'll go over some of those slides in just a moment. And when they first are exposed, after a period of time, 3 to 10 days, they will start to shed some eggs in their stool. The shedding will continue for 10 to 14 days, and then it stops. So if you think about it in the long scheme of how long you might have your cat, depending on whether it's indoors or outdoors, 2 to 20 years, if they're exposed, they might shed these eggs for 10 to 14 days. As a veterinary hospital, we run a lot of fecal samples. We send them out now, but we used to run them all in the hospital. And we're looking for parasite eggs in these fecal samples. We're mostly looking for roundworms and whipworms and things of that nature. So in all the years that we've been running fecal samples, you would think that we would run across toxoplasma at least occasionally. We see a lot of outdoor cats. A lot of them are hunting. And if you had to guess, these are the toxoplasma eggs that we might see. If you had to guess how often we see this, you might think, a couple of times a month, something like that. We can recall, and I asked my staff about this, we can recall one sample in 30 years that we found the toxoplasma eggs in, and it was an asymptomatic cat. So these cats are not shedding eggs all the time in our household. We really do not have to worry about this so much, and this maybe we should give this to the hoarders. So a cat that's had toxoplasmosis, as we've just seen, they're probably the safest cat to be around. So if your cat has had toxoplasmosis, even if it's exposed again, it probably will never shed those eggs again. So those are very safe cats to be around. You can have your cat tested to see if it has a titer. Positive titer means it's had it. You're probably safe. Negative titer means they're still vulnerable to getting it. And we'll talk in a minute about ways that you can keep your cat from getting toxoplasmosis. First, I want to just mention cats, when they get toxoplasmosis, it really is not a very distinct disease at all. Most cats show no symptoms whatsoever. The disease can be very mild or it can be quite severe. If your cat is sick with toxoplasmosis, the signs might include fever, lack of appetite, lethargy, and occasionally pneumonia. In some advanced cases, we'll see cats with ocular eye manifestations or central nervous system disease. But most of the cats have no symptoms at all, or if they do, they're very mild symptoms resembling many other illnesses. When people get it, kind of the same thing. We know from doing antibody tests that probably a third of the people on the planet have been exposed to this disease, which seems like a very high number. There are some countries in which the positive titer rates are as high as 58, 68%. So it's everywhere. We've all been exposed, or not all, but many of us have been exposed to it. So when people get toxoplasmosis, most of the time they also are asymptomatic with their infection. Others may experience mild flu-like symptoms for 1 to 10 weeks. So in a year like this in Buffalo, you'd be hard-pressed to figure out that you actually had toxoplasmosis. The disease, though, can be very serious and even deadly for people who are immune compromised and for the fetus if it's exposed during the first trimester of pregnancy. And some of those cases are very heart-wrenching indeed. The fetus can be stillborn. It can be born with severe problems, life-threatening and lifetime problems. So it is a very, very serious and not a laughing matter at all. So humans, if you want to know, am I one of these people who's already been exposed, you can get a blood test done and have a titer done to see if you've been previously exposed. Most people don't do this, and it's really not necessary to do this, but if you've been previously exposed, then your risk of danger is really quite minimal. Do we get toxoplasmosis from exposure to cats? Well, since the infected cats only shed the organism for a few days during their lifetime, the chance of getting it directly from your cat is really quite minimal. Should you avoid cats to protect yourself, it's probably not going to do any good. And we've found through many, many studies over the years that the incidence of toxoplasmosis is not related to cat ownership. So what's the problem? How are we getting it? And we're getting it because the cats that are infected for that brief period of time, if they're outdoors, which is where many of the hunting cats are, they defecate in the soil and they deposit the eggs there. Those eggs can stay infective for years. We can get it directly from the soil, from contact with contaminated soil when we garden. We can get it from undercooked meat. This is an indirect source because those animals are getting it directly from the soil. If we handle or eat undercooked meat, we can be exposed in that way. And also, something that I really hadn't thought about till recently, but the handling and eating of soil-contaminated produce. And there have been quite a few food outbreaks recently with salmonella in different produce, and I think toxoplasmosis is a potential risk there as well. So the sources of infection for the cats and for us, it's kind of a mixed bag. Undercooked meat, gardening, sandboxes. Cats think those are great litter boxes. Contaminated fruits and vegetables, shedding cats. If a cat is shedding that, one thing I didn't mention earlier is that the eggs that come out in the stool are not infected for 1 to 5 days. This is the reasoning behind scooping the poop daily or having someone else change the litter box. Not that we should discourage husbands from changing the litter box when wives are pregnant, but really it's not necessary. Okay, so how can we avoid exposure? Washing our hands, wearing gloves for gardening, using care with raw meat, avoiding undercooked meat, washing produce, and covering sandboxes. And just a a shout out to those nail biters among us to be careful as well. This is Olive, our hospital cat. I just want to mention that years ago there were very few people who were considered immunocompromised, but now this list has gotten much, much longer. It includes transplant patients, HIV-positive patients, those with cancer or chronic diseases, and anyone now on an immune suppressive drug. Now, many of us are being put on immune suppressive drugs for diseases like rheumatoid arthritis, psoriasis, and all of those suppress our immune system and make us more vulnerable. And of course, the fetus in pregnancy. The Centers for Disease Control, though, they no longer advise that you have to avoid cats if you're immune compromised, because they've found that the benefits of cat ownership really outweigh the risks, but you should take the steps we talked about earlier to minimize your chance. I know I have to speed it up here a little bit. Some things to think about: if you own a cat, you should talk to your veterinarian, share with them that you might be more vulnerable. Some of the things to test for would be leukemia virus and FIV testing, Bartonella testing, and stool sample checks for parasites. We've really done that. And how to protect yourself, again, pretty much what we've talked about. Again, our hospital cat on a particularly dull day at the hospital. So I just want to very briefly talk about rabies, because one of the other things I frequently hear is I don't need to get my cat vaccinated because he's indoors. And nothing could be further from the truth, because an indoor cat is far more likely to come in contact and catch a bat than an outdoor cat. And any wild animals your cat comes in contact with are presumed rabid unless proven otherwise. Until recently, it was considered 100% fatal. There's now a documented case of a young girl who did survive rabies. So in New York State, it is the law to do it, but more importantly, they are the barrier, the buffer between us and the wild animals, and by vaccinating our animals, it's the reason we don't hear about a lot of rabies deaths in this country. An exposure can often occur when we don't even know it. In fact, more than half of the cases, the fatal cases of rabies that were documented through DNA testing to be from the bat, those people had had no known exposure to the bat. So was there a bat in the house when they were sleeping? Did they walk into a bat cave? Did a bat brush against them? We don't know. They got bat rabies and they didn't even know that they had gotten a bite. Very briefly, distinctions in the law: if you've been bitten by an animal, that animal can be confined for 10 days to make sure that it is alive and well. If it is alive and well 10 days after it bites you, it could not have had rabies virus in its saliva, and you do not have to be tested. If you do not get the biting animal to observe them, you do need to go through a series of rabies shots. And this is usually, at this time, a series of 6 injections. The problem is if your pet is exposed to a potentially rabid animal and it is not up to date on their rabies vaccine or has never had one, the health department can require a 6-month quarantine or actually euthanasia. The quarantine they recommend is in a special double cage where they can never be touched. They have to go from one side to the other side. It's really a pretty gruesome process. So really getting your animals vaccinated against rabies is an important thing to do. It's the one vaccine that really has a very important public health significance, and we can debate the other vaccines, but this one is very important. The other important mistake that most people make is, I hear time and again, there was a bat in my house, we got it out of the house, we were so happy to get it out of the house. That's one of the biggest mistakes that people make. They need to capture that bat and they need to have it tested to find out if it was possibly carrying rabies. I know bats are endangered at this point with white nose syndrome, and nobody wants to destroy those animals, but when you think of how high the stakes are, the bats that are in your home really do need to be captured and tested. And that is a very fun thing to do, I will tell you from firsthand experience. Nothing gets your heart going faster than trying to catch a bat in your house. They should not be crushed. They need to be humanely euthanized and presented to the health department. So zoonotic diseases do pose a danger to us all, but there are very simple steps that you can take that will really minimize your risk for any of these diseases. I hope that was helpful.
Thank you so much.